Hi, my name is Narada Immaculate and I'll be performing dressing change with stereo technique skills video. I have my supply, I gather my supply, I have my patient or my wound, I have my dressing kit, I have my gloves, and then I have my hand sanitizer. Um, I know I close the door for privacy, and then I come and I introduce myself to my patient. Hi, my name is Narada Immaculate and I'll be your nurse today. And I ask for two identifier. What's your name, your first and last name, and your date of birth? And my patient tells me. After that, I ask for any allergies that my patient may have. My patient will tell me. If they tell me they don't have allergies, and then I also introduce the procedure to them. I tell them what I'm going to do. After introducing the procedure to them, I perform hand hygiene. After performing hand hygiene, I put on my normal gloves. After dressing up my normal gloves, I take a look at the wound, and then I take off the bandage. I dump it in my trash can, and then again I take a look at my wound, trying to assess for any odor, assess for any drainage or leakage, and then any color change. After doing that, I take off my gloves. And get my two hands and dump my glands. After doing that, I perform hand hygiene again. And then I look at my dressing kit, see that it's not opened, that it's still intact. I make sure that there is enough space from where I'm going to do my procedure, and then I peel off. After peeling it off, I fold it under. I make sure that I have enough space where I'm going to put my sterile gloves, and then I get my sterile gloves from the dressing kit. I make sure I only touch the 2 centimeter border like this. I don't touch inside so I don't break sterility. Unfold it. And then I make sure that I'm not touching the table so I don't contaminate my gloves. And then I get my non-dominant hand, and that's my left hand. I hold the tip and then put making sure that the cuff stays on. My cuff is on, and then I get 2 fingers, press them on the inside of the other glove. Make sure that I don't touch on the inside. leaving my cuff on. And my cuff is still on. After I'm done with that, I make sure that I use my non-dominant hand, and then I use my right hand, and then put my swab, my cleaning swab, into my left hand. This is my cleaning swab. I drop it inside my left hand, and then I clean my wound inside out, and after that I dump the swab. After dumping the swab, I get my gauze. This is my gauze. And then I dry my wound. Dry my wound, make sure that it's dry. I make sure that I dump, and then after that I get my TAGMED. So I'm dressing up my wound. This is my TAGMED. And then after I've dated my TAGMED, I take off this and I trash it, and I'm done with my skills, my dressing, my wound dressing. And then after I take off my gloves, and then perform hand hygiene. After performing my hand hygiene, I document my procedure, and I thank my client or my patient. Thank you.